Hi, Dr. Christopher Maloney here, talking briefly about Lyme disease. Now, if you know anything about Lyme disease, you'll realize that there's basically a great deal of controversy about Lyme disease. There's people on the one side who believe that chronic Lyme disease is really the disease of our age, and it's causing an enormous number of problems for an enormous number of people. And there's another group that basically agrees that there are increasing cases of acute Lyme, but really has no tolerance for the chronic Lyme idea, and for the most part has kind of gone away with an idea that Lyme is basically something that you can deal with acutely. You give it antibiotics and you're good. And this group over here is saying, look, there's all these co-infections that are happening, there's all this other stuff that's going on, and the two groups are not talking to each other. I really wish they would, because for me the underlying problem is that we're still focusing on the diagnosis of Lyme, and all I'm seeing in terms of treatment is antibiotics, large-scale antibiotics. I have a friend who's a specialist in this area, and he's moved on to supportive therapies, but that core research is being done primarily on antibiotics and how to use them in what combination. And the argument is basically how much antibiotics do you give and over what period of time. And really the argument is to move away from that to how do we treat this without any antibiotics, because people can't be on antibiotics forever and ever and ever and ever and ever. That just isn't a solution that we can really have people do. And oftentimes the patients that I see are people for whom the antibiotics have worked, but who really can't stay on it for all the side effects reasons. And so basically at that point, again, I'm trying to give them some kind of support, some kind of treatment, and I'm looking at the literature and saying, there's nothing here. All that people are doing is like, well, IV antibiotics versus oral antibiotics. I'm like, well, we need to move on to other lifestyle and interventions that help support the body in this process. The other thing that I think is fascinating is we've moved kind of into a range where we've got two different sets of tests, two different sets of labs that are happening, and my answer is that no one again is looking at not so much the spirochetes in the system, which also exist in animal models and continue to exist in animal models. You can actually see the spirochetes in the animal models in a chronic model, but the spirochetes aren't necessarily corresponding with symptom picture. And what I think is we really need to move to a point where we're saying, look, we're maybe doing genetic testing or doing antibody testing to the antigen of Lyme, and see if we're really seeing a that group of chronic Lyme people are seeing an out of proportion response to what would normally be a minimal allergen, antigen, so that we really want to have a whole change in the debate of Lyme.